My name is Sergio Valverde, and I am an orthodontist specialist from Lima, Peru. Just before finishing dental school, I chose orthodontics because there's a lot more thinking process, I think, during the diagnostic stage. It is about analyzing proportions, balance, aesthetics, biomechanics, and it leaves a lot for creativity too. You know, you have to be creative to solve situations, and I love that. Well, that's my job. More than a job, is my passion. It changed me a lot because I become more organized in different aspects of my life. It helped me to connect with amazing people around the world. I love that. I can spend hours talking about orthodontics with my peers. I enjoy sharing with the younger ones, of course. I love that. It makes me feel important, you know, as I can make, I have to make important decisions for the patient's smiles. So the orthodontist is a very important member of an interdisciplinary team. So you decide when to remove healthy teeth and where to open spaces to put an implant, or how to distribute spaces for cosmetic dentistry. So I feel like an important member of a group that brings care to patients. Well, actually, there is scientific research providing the impact of orthodontics in people's life, like in having better chances of getting a job or improving personal relationships. So if we can influence people's lives, self-esteem, how they relate with others, then I think I can say that we have the ability to make people feel valuable, and then build, starting from there, we can build a better society. Well, I can tell I come from a family of dentists, father, mother, dentists, and then I have two brothers, dentists as well. And we all three brothers are married with dentists. Then my wife's father, brother, and grandfather are dentists too. So I believe I knew about malocclusions since I was 6, maybe. And well, actually, there's sometimes when we come together, we are talking about teeth. There's some pictures in a Christmas Eve with X-rays, all the guests with the X-rays. So I'm surrounded with dentists, and I think that to make a difference, I started to look to improve myself. I learned a lot of photography, and I think that helped me to make some difference in the family. So that's it. Well, the most difficult case, I may say, that is the one, the patient who we have a patient that didn't or don't want to understand the case presentation, or they don't want to understand the informed consent, or the patient that didn't follow the instructions of oral hygiene and brackets care. Those are the most difficult situations to treat. But if you are talking about clinical cases, I think that maybe the ones that involve ankylosed teeth, and the reason is because we are not able to move ankylosed teeth. So that's a big limitation for an orthodontist, or maybe the patient that doesn't want to do an indicated surgery. They change their mind, and that's difficult to change plans. You know, that's the most difficult patients. I'm going to be concise in that. For me, it's mini implants for sure. They change everything in many aspects, because you diagnose, the diagnostics won't change, but your view of what you can do, it change. So you change your treatment plan. So for me, it's super important. Nowadays, I think that the move is going with digital technology for orthodontics, of course. They're improving a lot of digital imaging. They are improving that for treatment with aligners. So I think that will be the where all people will be looking in the next years, of course. Dr. Kravitz invited me. He never told me why, to be honest. I never asked him. But I believe that maybe because I like to participate a lot in social media conversation with cases, or sharing my own cases, or giving some tips on the cases. And well, that was it. After that, he invited me, and well, I believe in him, so I believe in him to make things even better. As a Pearls section editor, I want doctors to have an easy reading clinical articles. So my responsibility is to review the articles and choose the ones with good foundations, with biomechanical sense, with photography that could help the reader to understand the idea. And then if the article is good, I help the author to be concise with the information. And it's a big responsibility, because Dr. Pravis have this charge before, so he was responsible of this section before, so it's important to me. Well, JCO was the journal I read all time as a resident. I learned a lot from JCO. It was like one more teacher for me, during the residency. So to me, it means the chance to give something back. I can share with new generations, new clinical staff, and of course, I can help them too to remember a lot of good information that is already published. So it means a lot. JCO give us that something that we can apply to our patients on Monday. You can read very sophisticated clinical archive, but here in all the issue, for sure you will find something you can apply easily on Monday. A very clinical and efficient tip or pearl. It gives us a variety of tools, clinical tools, of course, diagnostic tools, office management tools. So JCO will cover a lot for us to improve. Sure, it comes to my mind some articles, some classical articles in diagnosis, as I said before, how to do better smile diagnosis, about extraction decisions. The Dr. Rinchus, he published a paper about extraction that it's a must read. It will help you to make better decisions. And about mini implants, there's valuable information, especially from Dr. Ludwig on this topic. And a topic I learned very much. I think I didn't learn in a good way in my residency. Is about canine replacement treatments. Dr. Rosa, Dr. Sacrison wrote amazing articles about this topic. So reading it was like they teaching to me directly. It's super, super, super well explained. And I will be sure to post that on the Instagram account too, so the new orthodontists can follow. Because nowadays there's a lot of information in social media with no scientific evidence that can be misleading. This information can be with marketing purposes or just for the ego of the one publishing it. So in the JCO, you will find valuable peer-reviewed information for your daily clinical practice. You can access webinars from all around the world where people do things different. So you will learn from them too, with excellent content, of course. And you will find the complete explanation of every clinical step. Sometimes on social media, you just find the picture and you don't know what happens after, and you don't have the complete information. With JCO, you'll have everything of that. Very clinical, very understandable. I may say that three things. First one, I wish I will know more about SMILE. In the residency, the professors are very they're very centered, they're very focused on teaching about the sagittal correction, how to reach that class 1. That's good, that's okay, but I will wish to learn more about SMILE, because we learn a lot about biomechanics and how to move teeth and achieve the class 1. But when we are out of the residency, we will be saying, come here, we're doing a big SMILE makeover, but you don't learn enough about SMILE. That's what I think. So I wish to learn more about that. The second thing, maybe vertical management of the patient. As I was saying, always sagittal, maybe not too much vertical. I learned it like after. And then I think, or I may say, expansion with mini implants. That's something new that opens treatment for adults. Most of my patients are adults, so I think that I would love to learn that before. Learn photography and take pictures. Some people know photography and they don't take pictures. So learn photography if you don't know photography, clinical photography, and take pictures. Take good quality pictures, because you need the pictures so you can review them. And you have to do it even if you're practicing ortho for a long time. You will find your own mistakes there. What is beautiful about orthodontics is that you will be able to correct what you're doing wrong during the treatment. It's not final. It's not like, I put the veneer and this is a final color and it's wrong, and that's final. You have to redo it. In ortho, we are treating the patient, and during the treatment, we can find our mistakes and correct. You can do it better. So if we have, that can happen, some ego problems too, finding our mistakes, it's no problem. You're your own teacher. It's your picture, your case, the solution. You will find the solution by yourself. And if you don't find the solution by yourself, share with somebody else. You share the picture and you talk with somebody else. Sometimes talking at the end, you find the solution yourself. I'm thinking about two advices. I will say that the first one is learn how to use mini implants. If you don't learn that on the residency, find a course. Diagnostic, as I was saying, won't change, but your treatment planning will probably change for better. You will have more tools to do something more efficiently. And the second advice I will say is read carefully Dr. Roy Sabri's article about the SMILE components. We as orthodontists are responsible of knowing everything about SMILE, so this article is free. It is JCO styles, it's very concise, and you will learn a lot there. If I have to pick one, well, not pick one because there are too many, but I can mention one that is about building composite buttons on teeth, especially because I thought it was my idea. I thought I discovered that, so I built it. I took some pictures, and I thought I will send an article about this because this is so exciting. I'm doing this now. I took the pictures, and then I will search for some background. I opened the JCO online archive, and I found that Neil Kravis published that like 10 years ago. So I wasn't the inventor of that one, but I was using it, not knowing that that pearl a lot in my clinical practice. So I told that Neil, and well, he told me that he liked the pictures, and there was some new content. So we do a new edition. So we're waiting it for be published.